Salam alaikum, Rukky. Thank you so much for joining in. We'll try that to pin topic down. Hello, brother Aman Agoro. Salam alaikum. Wa alaikum salam tila barakatuh. Sheda Danisa. Questions from you. Okay. Mrs. Biasi, thank you so much for joining in. Okay, yes. So we've got 3 people in the house. I'm just gonna wait for maybe 2 minutes to have a few people joining in, and then I will probably call our guest speaker. Thank you so much, everyone. I really do appreciate this. Thank you so much. Thanks for giving me your time. Okay. I'm just trying to send the live video to our speaker for her to see the link, and then she can join in. Yes, so today we'll be talking about appendicitis in children. Mr. Wole, thank you so much for joining in. If you've got any questions, I believe maybe some people would have gone through the post I did on, I think I posted it on Saturday or Monday. You might have gone through it and read it. The reason why I try to post it before we do the live video is to give people a bit of information about it. If you read it and understand a little bit about it, then you can actually get your questions ready for us for the live video. It gives us time to go through it, and then possibly anybody. So, and for the fact that I've been busy working and the doctor is busy as well, we need to come to an agreement on the time to do it. Let me see if I can call her myself. Sent her a request, and I'm waiting for her to respond to the request. Sorry guys, I'm still waiting. I wouldn't mind talking about it myself, but for the fact that we've got a doctor coming in to speak to us, I would want to leave everything for her to do, but then I can come in if you have any questions for me. So, yeah, it says she's not able to join in. Is there anyone in the house that can talk to us about it? Is there anyone able to talk to us about what appendicitis is? Maybe you have a little bit of information or knowledge about it. I wouldn't mind you, calling to join in. and talk to us about it. I don't want to be the only one doing the talking. It's going to be a chat for us all to talk together. We can all learn from each other. Does anyone know what appendicitis is, or do you have anyone that have had it in the past? Any experience, personal experience, or experience with people around you that had appendicitis in the past? What was the treatment and the whole condition? What was it like for them, or maybe for you or for your children? I don't know if anyone can hear me. Can you please signify by waving or sending a message if you can hear me? Because I feel like I'm just talking to myself. Hello, everyone. Can you all hear me? Or am I talking to myself? Okay, so maybe we can make a start. We've been here for a few minutes now. We're still waiting for her to, oh, thank you, you can hear me. Thank you, Ma. So what is appendicitis? Appendicitis is a painful swelling to the appendix. Okay, it's a painful swelling to the appendix. And, you know, the appendix is at the end of the large intestine. It's just there. There is no, okay, thank you, you can hear me. There is no physiological function for the appendix. It's just there. So, you know, a lot of people in Nigeria call it, the actual condition is appendicitis. But the name of the organ itself is appendix. The name of the organ itself is appendix, which is APPENDIX, appendix. But then the condition, which is the painful swelling of the appendix, is called appendicitis. A lot of people in Nigeria, even myself, before I started nursing a while ago, I just believe the condition itself is appendix, but it's not. The name of the organ that is at the end of the large intestine is appendix itself, but the actual condition where there is pain in the stomach is appendicitis. I don't know if you understand what I mean. I'm still going to try and call the doctor. Her name is Dr. Bello Taslim Aishat. Her name is Dr. Aishat. I'm still going to try and call her a few more times if she's going to be able to join in. Or it might be a network problem. She's in Nigeria, you know. So she might have problem with her internet. So appendicitis is the swelling of the appendix, and it's a small thin pouch that is located or situated at the end of the large intestine. It has no work there. It's just there for no reason. But then if it is inflamed or if it's swollen, it can cause a lot of pain, as in pain. What are the symptoms of appendicitis? Pain, like the child or the person won't be able to get up, you won't be able to walk, you might not even be able to talk. You know, as we talk and cough, we use all our muscles and all our organs, actually, most of our organs to cough and talk. So if there is appendicitis, you would know. It's something that is so easy to pick up, because the pain, though sometimes you might have it, you know, you might have it, but not have severe pain. But if it's a very bad one, if it's a severe one, the pain is just going to come. It comes like a very sharp pain that you can't even resist. Even the child or the patient with appendicitis will know this pain is different from a normal tummy ache. So the symptoms, one of the symptoms is pain, or when you press the area, when you press the lower part of the tummy, you feel pain there. Oh, she's in now. So I'm just gonna try and call her.
Hello. I'm stuck on the rock. Wa alaikum salam. That's why.
Wow.
Hello, can you hear me?
I can hear you.
I didn't know I would be outside till this late.
That's
That'll be
fine.
4 5 p.m. Yeah. So I'll just do a quick one. Yeah. So you can continue. Salam alaikum. Good afternoon.
Good afternoon, ma. Thank you so much for joining. We really do appreciate you. May Allah
You're welcome.
reward you and bless
Amen.
you so much. Thank you, ma. So
Amen.
I'll let you start. In order not to take too much of your time.
All right. Yeah. So I'm Aisha Bello Teslim. I'm a family physician in Lagos, Nigeria. So today we'll be talking about acute appendicitis in children. So acute appendicitis is just like an inflammation of the appendix. The appendix is like a continuation of our small intestine. That's a part of our stomach in the abdomen. So it's like a continuation. When it is inflamed, is a tubular structure at the end of the small intestine. So when it is inflamed, it can lead to acute appendicitis. Acute appendicitis can be caused by an infection, or maybe there's a blockage of the appendix itself. So when there's an infection, that's when a microorganism gets to that point and infects the appendix, it can lead to acute appendicitis. Or when there's a collection of mucus in the appendix, it can lead to an acute appendicitis. So it just means when the appendix is inflamed itself, or there is a stoppage of blood supply to the appendix, then it can lead to acute appendicitis. In children, the major symptoms that they complain of is pain. So the pain has a character, it has a certain characteristics. It starts with a pain in the navel area, which radiates to the right iliac fossa. The right iliac fossa tenderness. So the patient maybe the child can complain of pain in the they can complain of pain in the appendix, which can last for few minutes to days. Then it extends to the right iliac fossa. That's the lower part of the abdomen, the right part. It's a sharp pain. It can come and go. Constant. It might not be there all the time, but it can come and go. Then they can complain of vomiting, abdominal swelling, or increase in passage of stool, diarrhea. But the main characteristics in appendicitis is the right iliac fossa pain. Then they can now complain of fever. When there is an inflammation or an infection, especially in children, they always have fever. Fever is a major presentation there. Then, sorry, a minute. Be careful, Sumaya, come here. Is a major presentation, the fever, right iliac fossa pain, the vomiting, the stooling, which can occur in children. So it occurs within the age range of 10 to 30 years. Very young children usually don't a diagnosis of exclusion in children less than 10 years. Maybe when they do an abdominal ultrasound scan, they now see a child has been complaining of pain. They now do an abdominal ultrasound scan. They now notice that the appendix is inflamed in the scan. That's when they can now detect it in less than 10 years, especially in children in Nigeria. Yeah, it's not really a common infection in children here in Nigeria. It's a diagnosis of exclusion. So when a child complains of pain, vomiting, stooling, and they present to the hospital, the doctor examines the abdomen, they check for the tenderness, and they try to elicit different signs like this. There are different signs when they get to the hospital that the doctor tries to elicit in them. Then they carry out some tests, a full blood count, the full blood count, they try to check for the white blood cell to see if the white blood cell is elevated. So is elevated. The doctor will see when they request for a full blood count, they'll see if his white blood cell is elevated, and the lymphocytes there to see if it's elevated. Then they also check an abdominal ultrasound scan. Normally in a scan, the appendix is not really visible. But when they see it in a child, when they see the appendix in a child that it is visible, they can now see that as a cause that is appendicitis the child has. Then they can do other than investigations they can carry out as CT scan, MRI if it's not really visible in the child. So once they make a diagnosis of acute appendicitis, it can come as an appendiceal mass where the appendix is inflamed. The treatment is surgery, but when it comes as an appendiceal mass or they see an infection there, they try to treat the patients with antibiotics first. They try to treat the patients with antibiotics first to reduce the inflammation.
Okay.
Child on appendix, they can now work up surgery for appendectomy. Appendectomy is the surgery they do to carry out on children that come out with appendix. Yeah, can you hear me?
Yes, I
Hello?
hear you. Can I ask you a question, please?
Yes, you can, please.
You said the first point of treatment is antibiotics before surgery.
It depends on what they see on the scan. If it is acute appendicitis without an inflammation, or is obstruction there, they carry out surgery because it is an emergency. But if there is a mass, they reduce the inflammation first before they now plan the patient for surgery. They don't just cut it out immediately because it is already infected. Do you understand?
Okay.
Are you calling? Yeah. Yeah. So they place on antibiotics for a few days before they carry out the surgery. So the surgery they can do it like an open surgery, or they try to use a laparoscopy where they make a small incision and pass a camera inside to reduce the incision mark on the abdomen. I do that to reduce the incision mark of the abdomen. Yeah. So when a child comes in and they just see that it is acute appendicitis without an inflammation, it is an emergency surgery they carry out on the children. So they place the child after the surgery. Sorry, I'm with my kids on a rock. That's why I'm this. Yeah, just stay here. Come here. Just come here, please. Yeah. Come, please. Stand here. Hold me. Yeah, sorry for the break. Yeah, so once they carry out the surgery, they place the child on meal per oral. They don't they stop feeding in the child till the intestine settles down for it to accommodate the fluids. The first sign they see post surgery is when the child farts or passes gas. That's when they now start with liquid diets, oral sips to prepare the stomach to retain food. From there, they observe the patient. They observe the patient for a few days before they discharge the patient. So after acute appendicitis, the risk of a recurrence is low because they've already removed the appendix, so it can't occur anymore. And it's not like people don't really know the importance of the appendix in the abdomen. It really has no significant importance, so they can just remove it to prevent a recurrence. So what mothers or what parents are really scared of is the surgery, the risk associated with surgeries. There's no surgery that does not have any risk, but the risk with appendectomy is really low compared to a major surgery. So once a patient comes, as I said earlier, the appendix is like an inflammation. In summary, please. It's like an inflammation of the appendix, which can be caused by an infection or a blockage of the blood supply to the appendix. Once the patient comes and presents with right iliac fossa pain, vomiting, stooling, they go to the hospital, they carry out investigations on them. When they carry out investigations and they see a diagnosis of acute appendicitis, they prepare the patient for surgery. But if there is an inflammation, they place the child on antibiotics for a period of time for the inflammation to reduce before they carry out the surgery. And the complications are really low post-surgery. Yeah. Any questions, please? What's wrong with you people now?
I don't have a question. So
What did you
maybe one of our viewers can type any questions they've got, and then
Yeah,
we can take
yeah.
it from there. So much that I
So
really do
what is it
appreciate.
like in your side with acute appendicitis? The patients, because it's not really common in Nigeria yet, the diagnosis of exclusion in less than 10 years most of the time. Yeah.
Yes, here in the UK, well, my trust, my hospital is very common. I would say on
Okay.
every shift, we have at least a child or two or more that comes in on every shift with
On a
appendicitis
daily basis?
on a daily basis.
Are you serious? Yeah.
Yes, yes. Even I finished the night shift this morning,
Yeah.
and on my ward, we had two patients with appendicitis and their post-op.
Okay.
On this shift that just
So do you think it has to do with our diet, or why do you think it's commoner? Is it
common here
Is
than
it
in
as common in
Nigeria.
blacks or whites there?
No, no. But wait. Having said that, I think the
Sorry.
percentage of the black kids that have seen is not actually as much as Asian community or white community. It's so rare. Maybe it's because of the diet. And then you can remember
The
before
diet.
we had the chat. Yes, I mentioned something to you about Nigeria. I believe we have lots of children that have one illness or condition or the other that has not been
Okay.
picked up. We have parents that do self-medication at home. Those ones, they won't be able to, the number of the cases will not be added to the national total of the children with appendicitis. So that is going
Okay.
to reduce the number of children that they know has appendicitis in Nigeria. But here in the UK, we have a lot of children that come in every day with appendicitis.
Okay.
And the same thing you said is what we do. Though the first point of treatment here is surgery. We take to give them antibiotics. Maybe when they
Yeah.
come in, yes, we give them antibiotics as a start dose. And then
Okay.
we arrange them for emergency surgery for the removal of appendix straight away.
Yes.
Within, a time frame of maybe 2 or 6 hours after
Yeah.
admission to the hospital. So we give them IV antibiotics. They
Even when there is a mass there, do they carry out surgery immediately?
yes, they do.
Even with the mass?
They do. They don't
Okay.
tend to leave them. They don't leave them to the pain, like you said that if people in Nigeria they treat them with antibiotics for to try and reduce the pain. They don't do that here.
Okay.
But a lot of the kids that comes in with appendicitis is either we have just the painful one, but most times we have inflamed appendicitis. And then
Okay.
we have people that come in with just appendicitis, another of children with inflamed appendicitis, and another set of children with inflamed and perforated appendicitis. They
Okay.
get
Okay.
inflamed and then they get perforated. So, maybe in some cases, but I've not really had a situation whereby they just try to treat them with antibiotics. No. They treat them together and then they give them antibiotics after they give them post-op. And then most
They
of
give them
them
what?
they have
What do they give them post-op? They give them antibiotics post-op.
antibiotics. Yeah, we give them combination of gentamicin,
Okay.
metronidazole, and cefuroxime. The
Okay.
three antibiotics is what they used to treat them post-op. And then,
Okay.
they'll be on morphine. Do you tend to give them morphine infusion
No, we don't.
post-op?
We don't give them morphine here. We really give them pain relief with care. Unlike you, any small thing they give them morphine to knock them off. We don't knock patients off. Yeah.
Yes, we give them morphine here post-op, and they tend to be on morphine for 24 to 48 hours after the surgery to try and
Okay.
reduce pain. Yes. And then it's laparoscopy they do as well. The opening is
Oh,
just
they do
through the
that. They don't do open surgeries.
no, no. The surgery is done on the belly button and do at the
Yeah.
lower part of the tummy. That is what they do at home. They don't do open surgery like that.
They
Maybe
don't
for
open.
adults, maybe for adults, but for children they
Okay.
don't. It's
Okay.
just incisions, yes.
Okay.
And then they have diarrhea and vomiting. They tend to have, most of them have bowel vomiting.
Bouts of what?
Bowel vomiting.
Okay. 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 Yeah. But yeah.
we have twin government. We always tell them to do by mouth for 2 days, or the year of administration, they might be new by mouth, just like, or maybe a week or so.
Okay, so I want to ask a question. When a patient presents with peritonitis as a result of perforated appendix, do they just open up and carry out surgeries, or they don't still place on antibiotics for a few days before carrying out surgery?
I've not really seen them putting them on antibiotics for a few days before surgery.
Okay.
Okay,
I think the difference at your side, when the patient presents with all those symptoms, I think they report to the hospital immediately. Unlike here, where the patients will first take about concussions and different before they present, and is
that is what makes it different. That's what we give them paracetamol and ibuprofen and other type of pain. Most all of them, they always come back with either PCA, if it's a big child, if it's a big patient, they do on patient controlled analgesia of morphine, or if it's a little child, that's not able to control the PCA, we just give them a background infusion of morphine.
Okay, that's
it's a lot here. It's so common in the UK. We have children coming every day.
Okay. So I think why it is in your side also is because you work in a children specialist hospital, right?
Yes.
Unlike me that worked in a general hospital where I see different types of patients. Yeah. So that's why I don't really see. Yeah.
Yes. Now we have a ward. We have a specific ward that deals with things like they deal with things like that, and they have them on a daily basis for children. Thank you so much. Any questions?
I'll answer the questions later. Let me attend to my kids, please.
That's fine. Thank you so much. I really do appreciate you. You've done so well. Thank you.
You're welcome. I'm sorry that it's so short, but I think I'll be outside to this. Yeah.
No, you told us everything we need to hear. Thank you.
All right. Yeah.
So, how was that, guys? Do you have any questions? Is there anything you want to talk about? Do you have anything for me? I'm still waiting. I believe she has told us. I'm still, trying to get into the routine of this live video. So please permit me. I promise I'll get better on our next post, on our next video. She told us things about what we need to know about appendicitis. And if it's not treated on time, it can actually lead to death. We have patients that comes in with inflamed when the appendicitis is swollen and is infected. If such a thing is in the body, it's going to damage, it's going to cause a lot of damage to the body. Or perforated means, when there is hole in the appendicitis or when it's actually cutting into pieces. You can imagine how nasty such a thing is going to be in the body. So we tend to take them, here in the UK, unlike what Dr. Taslim said, in Nigeria, they sometimes treat them with antibiotics first, then they observe them, the patient, for a few days to try and shrink the appendicitis, to try and shrink the appendix. But here in the UK, we don't. We give them start dose of antibiotics, yes, but then we tend to take them to theaters straight away. Even most times, the children tend to go to theaters from emergency departments. When we have any child that comes to the hospital with any kind of illness, it goes straight to emergency department, where they're going to be seen by the triage nurse, then they will wait to see the doctor. That is when the doctor is going to diagnose what the child is into the hospital with. I mean, a normal child with a form of illness or disease or sickness that comes to the hospital, they'll be seen by the nurse, and then the nurse will categorize the patients to be able to, because we have children that comes in with, that tend to be they're being taken to the major accident and emergency department, which is where we have children with fracture or any kind of severe accidents that happen to them that needs to be seen there and then. We have that. Then we have minors. Minor department of the emergency department is just for kids with maybe appendicitis or one form of illness or the other that can actually wait to be seen. We tend to give the kids that goes into the major department priority, because that can be life-threatening. We give them priority over the children that goes into the minor department of the accident and emergency. So that is when the nurse will be able to categorize what kind of priority needs to be given to the child. Then from there, they can spend few hours in the emergency department before being taken to the ward that is, kind of specialized in what the child is coming with. Like my ward is an orthopedic ward. We deal with fractures of any kind. We also deal with ear, nose, and throat, ENT, kids that have promates, that have problem with their ears, or if you have a child that just puts a coin or a bead or Lego toy in their ears, or swallow a coin, or swallow any kind of foreign object like batteries, coin, button, or any kind of object that is, a foreign object. We deal with them on my ward. So I've said orthopedic, we deal with orthopedic patients, we deal with ENT, ear, nose, and throat patients. We sometimes deal with ophthalmology patients as well. My ward is a surgical ward, and we also deal with children with sepsis, which was why, which was why it was able for me to have, some knowledge about sepsis. That was our last and first topic that we treated last week. What else? We deal with so many kinds of surgical problems with children. So, that is where, children that comes in from ED tend to go to the ward that specializes in what they do with what's wrong with the child. But in most cases, or in all cases, children that comes in with appendicitis don't get transferred to the ward straight away. In most cases, they tend to take them straight to theaters to perform surgery to remove the appendix straight away from emergency department because they don't want to waste time. Any form of time wasting might or will be dangerous to the child's health. So they take them straight from emergency department to the theaters, they get operated on, and they bring them back to the ward. That is when they then transfer them from the theater recovery to the ward where the nurses and doctors will then continue the care post-op. Do you understand what I'm saying, guys? So children with appendicitis tend to get treated there and then. They give them antibiotics at a start dose to try and reduce the inflammation of the appendix in the child's body, and then take them straight to theaters. And when they come back from theaters post-op, as in post-operation, after being operated on, then we continue with IV antibiotics. We keep them on for, I'd say, a minimum of 3 to 5 days after surgery. But then we have severe cases. I know a patient that has been on the ward for over 2 weeks now. She's still recovering from appendicitis, and she actually had another surgery. She had her initial surgery. I have not had the chance to look after this patient, but then I know a history from my colleague that we work together. She had her initial surgery about 2 weeks ago, and I think something else got wrong with her. And this is a small patient, a small child. So they had to take her to therapist again a week after. So at the moment, she's currently at the hospital, even after 2 weeks of her initial surgery. We do have cases like that sometimes. It's not common, not all the time, but sometimes we have cases where things just go wrong after the initial surgery, and then the child will have to need another surgery to correct whatever has happened. So that is what we do to treat them. And the doctors would want them to be nil by mouth, as in nil by mouth, not to have anything to eat or drink. They can be allowed to drink sips of water or clear fluids, maybe Ribena or any kind of squash, but not tea or coffee or strong drink, just plain water or clear fluids, just to help them. And then we give them IV fluids to stop them from being dehydrated, and that's going to stop them from being hungry anyway. But then we tend to advise them, encourage them to drink a little bit of water to, to keep the mouth hydrated. So we do that, and then maybe after 3 days or 4 days, they can start eating soft diets, maybe yogurt or toast or jellies, and any kind of soft diet. And then maybe after 5 days or 6 days, they can start eating proper food if it is well tolerated in the child. And sometimes they tend to vomit. They bring out green vomit. It's not something to worry about, but this is very common and normal in children that has removal of appendicitis. No, that has removal of appendix. We call it appendectomy or appendicitis. Having green vomit is very common in these kids. It's nothing to worry about. Or if you have a child at home that has green vomit, you need to take them to the hospital to get checked straight away. It might be a form of, it might be an early symptom of appendicitis. Things like that are not what you would want to keep the child at home for, to try and do self-medication. And I say this over and over again. I'm not trying to, what's the word? I'm not painting Nigeria bad. Please don't get me wrong. I am a Nigerian, and I'm saying this generally. A lot of Nigerian parents do a lot of self-medication, and I tell you, self-medication is so very bad. Sometimes it can even be more dangerous and deadly than the actual illness the child has. So that is why me personally, I always advise parents to please take the child to the hospital or to the nearest clinic. If you notice anything unusual in your child's health, please get them checked, because health is wealth. So, but a child that hasn't had surgery, any form of surgery, that has green vomit needs to be checked upon. But a child that's on hospital admission following a removal of appendix has a green vomit, it is normal, in as much as it's not too much. And then diarrhea is another thing. It's common in appendicitis. And then, and there is no risk associated to removal of appendix. Is an easy and straightforward. It's an easy and straightforward surgery. There's nothing to be worried about. It's better to get it checked, to get it removed, than leaving it. And no parent will want to leave an inflamed or perforated appendicitis in the child's, intestines. So I think that's it. Do you have any questions for me, guys? Any questions, please, before we go? I just feel like I'm talking to myself because no one is asking any questions. No one is participating in terms of maybe adding to the point or telling us their experience or what they know or what they've heard about appendicitis. So that makes me feel like I'm just talking to myself. But this is actually meant to be, an interaction between myself and you people. Let's all join, let's exchange our information, our knowledge on what this appendicitis is, rather than me just being the only one talking. Because if you continue doing this, I'm going to keep getting shy. I'll just be shy all the time, But if we talk and interact, then that will actually reduce the shyness and the tension in me. Do you get what I mean? Any questions? Okay. Maybe we have to stop here today. Our next topic is ready. I've actually done the PowerPoint presentation. I was waiting to do this video before I post that because I don't want to, post another topic when we've not actually treated the present topic. So, inshallah, by God's grace, I will post it maybe tonight or tomorrow, whenever I've got the chance to do it. I'll post it on my page, and then I will try and get a specialist nurse that deals with. Anyway, our next topic is sickle cell. I'll tell you. So, and sickle cell is so common between the African ethnic, is common with the Asian. Sickle cell and thalassemia. Thalassemia is more common in Asian community, and sickle cell is common in Africa and the Afro-Caribbean countries as well. Sickle cell is common there. The white sickle cell is not known in white ethnic at all. At all is not. But it is very, very common in Africa, which is a very strong topic, which some people tend to shy away from it. And I don't blame them. It's because of the stigma. There is stigma for sickle cell, but it's just an illness. And besides, we thank God for technology. We thank God for for treatment around us now. What sickle cell is these days is a lot, I would say, million times better than what it was some years ago. And even those in the western part of the world are very lucky because of the available form of treatment compared to back home in Africa and Nigeria, for example. So this is a very interesting topic. I've had the chance of looking after kids with sickle cell. So I've got that ready. So I'll try and speak to a nurse, a nurse that is specialized in sickle cell to come maybe next week and give us a teaching and information about sickle cell, what to do, to avoid having a sickle cell child, which we all know. And if you end up having a child with sickle cell, the treatments, what to look out for, and and what not to do with the child. So I will try and get a specialist nurse in sickle cell to come and speak to us about it. If I'm able to, yes, and if not, it's something that I can actually talk about myself. So thank you so much, guys. I really do appreciate everyone. Can you please tell a friend to tell a friend and tell another friend about this topic? We need to get better at what we do. I need to get better at what I do. And I would appreciate, if you guys give me feedback. Please, I'm open to feedback. It's going to help me get better. And, if you tell everyone, we might be able to save a child, in the process of telling people and sharing this information. We might be able to save a child. And if we're able to do this, then, all the reward goes to every one of us. Thank you so much for joining in. I really do appreciate, for the fact that we haven't got any questions, I would probably call it a day. Or maybe I can wait for another minute or 2 minutes to see if I can get any questions. Questions, guys, please, please, please. All right. Abidemi, don't worry. I know you joined in late. That's fine. I'm going to save the video and I will post it on my page. You can watch it, and if you've got any questions, please let me know, and then we can talk about it. Thank you so much, guys. So appendicitis is, is a very, very dangerous illness that we need to look out for. Symptoms of appendicitis: swelling to the tummy area, pain, severe abdominal pain, unable to, the child will be unable to walk or cough or talk or smile or do anything. No question. Okay, thank you, Matt. So, appendicitis is very, very deadly and dangerous. We need to, it's good for us to keep an eye on our children, watch out for any difference or any changes in their body or their health or their personality. If you have a child that's always chatty and talking, and then maybe a day you just notice this girl or this boy is just being quiet, what measures is put in place to avoid this? Actually, there is nothing we can do to prevent appendicitis. It's not an illness that is preventable. It's not. It just happens randomly. It happens where there is a blockage to the intestine, where there is an obstruction or a blockage. There is nothing we can do as parents or as patients of the child, as a patient or as parents of the patient, to stop appendicitis from happening. There's nothing we can do, sis. But the best thing is to look out for any changes in the children. If you've noticed your child is being quiet, complaining of constant pain, after giving paracetamol, any kind of pain relief, and the pain is still there, it's not going away, or maybe temperature, it's always better to get checked. That is why I do say parents should always keep an eye on their children. You should be able to tell when there is a change in your child's body or personality, or what the child's do on a day-to-day, their daily activities. If the child is not being able to is not behaving as normal as they should do on a normal day, you have a chatty child which is just been too quiet, you need to call him or her, talk to her, and ask her what's wrong with her, and then you might be able to pick up what the problem is. So that's what it is, really. Have I answered your question, Omolola Ishola? And constipation as well. If a child is unable to open his bowel, to poo, that is another symptom of appendicitis, or diarrhea. Like I mentioned earlier, the green vomit. Okay, thank you so much, everyone. Thank you so much for joining in. I really do appreciate you. God bless you all. And, it's going to be me and you again in the next couple of days. Maybe it might be on Monday or Tuesday, but I will speak to okay, thank you so much, sis. I'll speak to the nurse. She's here in the UK. She works in London. I'll speak to her on, for her to come and discuss what there is no prevention. Yes, thank you, sis. That was what I said as well. Our guest speaker, Dr. Taslim, said there is no known prevention of appendicitis at all. There is nothing you can do to avoid it. But the first thing to do is to be able to spot when the child is unwell or the child is being sick. Then you can seek medical help. So I'll speak to the nurse, about coming to speak to us about sickle cell. If she's able to come onto the program, on the program, I'll post that. If not, I am more than happy to discuss what sickle cell is, the treatment of sickle cell, the causes of sickle cell, which we all know, but let's leave it. I don't want to bring the cat out of the bag now. We'll leave it till our next video. Dr. Bello Taslim said there is no known prevention of appendicitis. However, it is advised they eat good diet, high fiber diet with loads of fruits and vegetables, lots of grains, and not eating eba all the time. I know some people will come for me and I'm ready for you. Advised to eat fruits and vegetable, high fiber diet, and not eba all the time. Eat a lot of grains, proteinous food, nutritious food. They're very good to the body. They all have their functions in our body. Thank you so much for joining in. And thank you so much, Dr. Taslim, Dr. Bello Taslim Aisha. I really do appreciate you. God bless you, ma. We appreciate your time. Thanks for your time, and thanks for giving us part of your knowledge. May your knowledge increase on a daily basis, and you never have any Why, thank you so much, ma. So God bless you. Eba like you. I know you guys will come for me. It's fine. I still eat my grains, okay? I eat my grains and I eat high fiber diet as well. So guys, let's go now. Thank you so much. It's your girl Rukayat. How you doing? Nurse Rukky. I am so glad to have you guys. Join me, catch me next time when we talk about sickle cell. Bye.